You are going to be able to hear those of us who are presenting as panelists. However, we can't hear or see you. There is a question and answer box, and we will be working on getting folks to be able to have a dialogue during the question and answer session. But for the time being, like I said, the only folks who will be speaking and having video turned on will be panelists.
All right, I'll be back. I'll make something to drink. And no, it's not a beer.
Yeah, I don't want you throwing your cat and throwing back some beers there, Cesar. Okay.
Okay, I see that Danny is an attendee. He should be a panelist, right?
Yes, please.
Here he comes.
Do I have to have video on, or can I take the video off?
Maybe just while you're speaking. We have 52 folks in the room, so they can see you, but when you're talking, that will probably be best. It's up to you.
Okay.
Are we being quiet or am I on mute?
We are just kind of waiting. We've got folks joining as we speak.
Okay.
We're maybe about halfway to the amount of folks who've registered, so I was just giving everybody a little bit of time to settle in. I'll kind of repeat what I said before. Folks who are panelists are going to be showing up on your screen. Hello, everybody. Folks who are attendees, you're going to be muted without video. You'll see us, but we can't see you. There's going to be about 200 of you tonight. I have been posting instructions on how to access the language interpretation channel for those of you who want to listen to the meeting in Spanish. I'm posting that in the chat box now. Like I said, we're going to wait just a few more minutes and then we're going to get started. We have a tight hour, so let's give it just 1 or 2 more minutes. Okay, folks, it's a little after 5. Let's go ahead and get started. Welcome. This is the Westside Regional Town Hall. I would just like to remind everybody that the folks you see here on your screen are going to be your panelists, the folks who are going to be able to speak and have their video on. Those folks are going to be presenting, and the rest of the participants are going to have no audio and no video, so no worries there. Within the chat box, I have posted instructions on how to access language interpretation channel. If you'd like to hear this meeting in Spanish, there should be a globe icon at the bottom of your screen. You're able to click on it and touch the language that you would like to hear. Otherwise, you will be defaulted to hearing the meeting in English as we are speaking. I'll go ahead and hand the floor over to our Interim Executive Director, Dr. Kelly.
Thank you, Kate, and thanks for the directions, and thanks Rhiannon and Kate for setting this up and getting us going, and also with our translator, thank you for providing translation. Well, folks, I wanted to have an opportunity to get everybody together and to speak to the community. I was hoping when this initially, the COVID-19 initially started, that maybe by now we would be having a live town hall. Unfortunately, it seems that this is not going to be a short run. This is going to be a long journey for all of us. Obviously, this is an unprecedented situation, and we've all had to adapt. I would like to begin by just saying that I cannot say enough times or the extent of my gratitude towards this whole community, to our providers who are still providing direct services, many of them, or have been very creative and imaginative in how they are able to deliver remote services, virtual services, telehealth services. We're learning. I wish I had all of the answers. We're still trying to figure out what some of the questions are, but it's obviously a novel time. And I also want to say that I appreciate our staff who have really been as flexible, creative, imaginative, empathic, compassionate as I can possibly imagine. And to the community for all the positive feedback, to the support that you've given us. It's really been welcome. It's nice to hear good things. It's nice to hear ideas, and also to engage in creative problem solving together. I think that the main message that I would convey is that this is something we're going to have to do together. And fortunately, we have a great community. We have a very resilient community. We've been through a lot together, and we've shown that we have a lot of fortitude, a lot of strength, and that we can endure just about anything that this world throws at us. And I really appreciate everybody. Thank you. I know I'm on the clock here. Kate's probably going to be giving me the award show music if I go on too long, but I wanted to address a few areas. One of the things that I know a lot of people have been asking me is, when are we going to get back to normal? When are we returning on site? And right now, we're kind of monitoring the situation both from a local perspective and from a state perspective. And things on the ground keep changing day to day. Most likely, we're going to take a very conservative and cautious approach. We already have some staff on site, and we have critical structures that still need to happen on site. And then ultimately, we're probably going to phase back to on-site operations that'll happen over the summer. I don't anticipate that even by the end of summer, we're talking into August, that we're going to have everybody back on site anytime soon. It's probably going to be staggered. We don't want people in shared spaces. We don't want anybody in meetings happening with groups of people. And we have a smaller site, and we have a lot of shared offices. So these are all problems and hurdles that we're going to have to overcome. We also have to be very mindful of all the protocols. Right now, for the staff that do go to Westside Regional Center, we emphasize wearing masks, all the standard guidelines that we all know by heart by now is washing our hands, not touching our face, although when you think about it, that's all you want to do, and trying to be mindful of social distance and staying at least 6 feet apart. We are probably through the summer, we're going to be working with the skeleton crew on site, and we're not going to be having walk-ins and having people come in remotely. This is both just to protect our staff, but also to protect our community. I think right now, Los Angeles County is still considered a hotspot, and we are still experiencing increases in cases. It's leveled off somewhat, but I get regular updates, and it's kind of like a little bit of a roller coaster, and we haven't gotten to a place where we're really at a safe area. If you look on our website, we have a great wealth of information that we continue to post. All the direct links to the local health department, to the state health department, every resource that we kind of get our way about, help with unemployment, help with accessing generic services, anything that you can imagine, you could probably find on our website. I know it's a little bit difficult to navigate because there's so much information coming at us every day, but there really is a lot of information. And if you don't have a specific, or you're not sure, what we can do is we can get out to individuals. I have like a kind of a contact page that summarizes where our links are and how to find them. We have been preparing, we were preparing from the get-go for the worst case scenario. We have been getting deliveries from both DDS and from the Department of Health, protective equipment, the PPEs that we refer to. And we've been following CDC, Department of Public Health guidelines as far as distribution. DDS made it pretty clear when we got our first initial shipments that those we were sending out to our caregivers and direct support staff, people that were working in our congregate settings, in our fishing homes, our IFCs, trying to protect the staff that have direct care responsibilities. Obviously, our biggest fear was in the congregate settings, where you have a group of people living together. Also, a group of people often who are medically compromised, immunocompromised, and have at-risk health issues. So we have been trying to ensure that all those folks can get all the equipment they need to maintain their safety and the safety of the consumers they're taking care of. We have some additional supplies that we are holding on to, and with the idea that we may at some point experience surges where we have to move individuals out of group settings and into different beds that we've identified where we can successfully isolate individuals. And we're going to need care providers, and they're going to need protective equipment. However, we have also distributed to some families if we become aware that somebody has been exposed and that there is a risk of them having COVID, they've tested positive, trying to get it out to the families and to the care providers in those homes as needed. The intake and eligibility, I'm kind of wearing multiple hats, interim executive director, but also clinical director. Our intake and eligibility services are continuing. We're still taking intakes. We're still doing evaluations. We're still doing clinical assessments. And again, it's because we've been able to be very imaginative, very creative, and have been able to do telehealth. What we'll do is we'll evaluate people using screenings on the phone, using Skype, using virtual mediums, doing clinical observations and testing. We managed to do intellectual testing remotely. So fortunately, we've been very creative, and we're trying to assume kind of try to approach as much normalcy as we can in what are very unusual and abnormal times. We're still open. We have a receptionist, but not on site. But if you call our office, and every now and then I will myself check on it, you can expect a live phone call. In addition, if you call your service coordinator, you call somebody at staff, you can expect that those phone calls are being transferred to individuals. And we're keeping business as usual, trying to respond to phone calls within 24 hours and get back to everybody. In addition, right now, because we recognize that contact is important, is trying to reach out to as many folks as we can. I think I had 10 minutes. I'm at 11 minutes, Kate, so you don't have to put on the Academy Award music and pull me off the stage yet. So I'm going to hand it off, I guess, to Danny to talk a little bit about our finances.
Good evening, everyone. As some of you may know, the May revise came out this afternoon. Not sure if anyone's had a chance to go through it, but just to give you guys some highlights of what's in the May revise for the system. The governor had proposed some new initiatives for next fiscal year in his January budget. In his May revise, he's pretty much canceled those. So performance incentive program for regional centers, that's been canceled. Enhanced caseload ratios for children ages 3 to 5, that's also been canceled. The START training for dually diagnosed individuals, that's not going to happen next fiscal year. And the provider rate increases for early start, infant development, and independent living services also have been canceled. In addition, he's also proposed some cuts. And these cuts, depend really on how much federal funding the state receives. So in other words, depending on how much federal funding the state has to supplement its budget, we may have, the cuts the way he's proposed, or they may not be as bad. But some of these cuts and initiatives that he's proposed is a $300 million cut in provider rate cuts. So he's going to be evaluating rates. Another cut that he's proposed is $30 million in regional center operations. So that's going to affect us, obviously. Uniform holiday schedule, they're thinking about, well, they're going to implement that again. And that is a forced closure, mandatory closure of programs on certain days. They're also proposing a cost sharing initiative for services for higher income earning families. That's also in the May revise. So, it's the May revise, it's not set in stone. It still has to go through the legislature and then signed by the governor. But that's what's in the May revise. What that means for us is, operations wise, we're going to have to, tighten the belt a little bit and kind of, not look to expand at the moment, and be prepared to take on any obviously budget cuts that are going to come our way. POS wise, the uniform holiday schedule, does create some savings, but it'll also, there's nothing in the budget or at least from my opinion, too radical when it comes to programs and that sort of thing. So that's where we are with the state budget. More to come, and stay tuned.
Hi, my name is Mary Lou Wiestusser. I'm the Director of Community Services, and I want to go over some of the things that are happening out in the community. The first thing is just to let you know that Westside has been monitoring the impact of COVID-19 and suspected COVID-19 cases since the beginning of this. Each day we complete reports that are submitted to DDS and also to our executive team. And we follow individuals who have symptoms, who have been tested, who have been hospitalized, regardless of whether it's COVID related or not. And also working with people that have tested positive and assisting them with obtaining places for isolation. So currently, Westside Regional Center, and this is staff and individuals, the staff and service provider staff, have had a total of 68 people that have been tested. 14 have been positive, 48 have been negative, and we have 6 that are pending. These cases, fall within our supported living services, about 29 of them, in family homes, about 7, in residential facilities, 26, in hospitals or what we call skilled nursing facilities, 5, and our family home agencies, 1. These are cases that are reported to us. My fear is that there are probably more, and we encourage people to let us know so that we can provide the services and supports that you may need during that time. One of the things we've been diligently working on are what we call surge sites. And these are a variety of settings where people who test positive or are recovering from being hospitalized can go to so that we can help them and support them while they go through 14 days of isolation, which is required now. Or if you're sick, 72 hours without fever or needing fever medication plus 10 days. So Westside is fortunate to have 4 family homes that can support up to 3 people each. 1 medical home called an adult residential facility for persons with special healthcare needs, which can house up to 5 people. We have 2 community crisis homes that are coming online that will be able to house up to 4 people. And 1, what we call a family teaching home, which is a duplex that would be able to help assist up to 3 people. So we've been working diligently on those. We've had to use 2 of the slots, but it's been very successful, and it's helped to prevent the spread of the illness in other congregate settings. So we continue to have a close contact with our service providers. We've had 2 service provider advisory committees that were very well attended with 50 plus providers on our Zoom call. We are beginning to do Zoom check-ins at our residential and congregate settings, which has been very successful, being able to talk with residents, talk with the staff, visually walk around the house while they hold their iPhone or their device. So it's been very positive, and we're starting to do that more and more now that people have all the technology. In addition, if we have any special incident reports, our risk management coordinator is very much on top of those, and she makes sure that we follow through. So our quality assurance staff are continuing to address special incident reports. A lot of it is by Zoom or telephone, and currently things have been pretty calm, and we work closely with client services staff to ensure that if someone needs extra support needs during this time, that they're available. Let me talk about, there's been a couple of directives that have been a little stressful for people. One of them is the directive from the LA County Department of Public Health, in which they have now, or several weeks ago, said we don't want any visitors into residential settings. Started with skilled nursing facilities and nursing homes, but it's trickled down into the small family homes that we have. This has been done to protect individuals, to keep people safe. We know it's difficult, we really do, but we have worked with our residential providers who are making Zoom, FaceTime, and any other virtual connections available. And Westside keeps working with community care licensing and county health to try and see how we can modify this a little bit depending on the situation. So it's a work in progress, and we understand it's a struggle for families not being able to be in the same room with their loved ones, but we're working on it. Finally, there's been a big change to our adult service providers. When we were told that we needed to shelter in place, people could no longer go to community programs or go to what we call site-based day programs. But I have to say, our providers have really stepped up. They have created some fascinating and fun programs that they're doing virtually. They're constantly checking in on people. Many providers have lists of who needs how much contact. They're having movie nights. They're working on, developing gaming programs and things like that. So they've really done a great job. And when we met with them earlier this week, they are committed to becoming a community that is dedicated to getting to developing services that can support our adult services, both virtually and when we're able to go back into the community, developing smaller type programs that will address the needs. So they're really working hard, and I'm looking forward to reporting more on new innovative programming and services. Thank you.
I think it's me. Hi, everybody. I'm Hillary Kessler. I'm the Director of Adult and Residential Services in the Client Services Department. And I just want to say the service coordinators and the program managers have been working really hard, and I think really well, to ensure that the people we support's lives are disrupted, at least from their standpoint, as little as possible. As soon as we got the directive from DDS to shelter at home, service coordinators were tasked with having to contact each and every person on their caseloads. So they were directed to make a phone call, but some people prefer email, so they sent an email. And we're tracking every time we contact a family. And for those individuals who either weren't responsive or maybe moved or have a new phone number, we couldn't reach them, we've sent snail mail letters to each and every one of them to check in, to remind them that while we're not in the building, we're open for business. So we're still working and we're there for you. If you need your service coordinator, but you forgot their number or whatever, you can call the main number, the 310-258-4000 number. You will get a live person who will be able to either get you to your service coordinator or somebody who can help you. And any reason that you call is a good reason. Service requests, questions, concerns, a need to talk. We're available, even though we're not in the building. And I also want to take a quick minute to thank we've gotten a lot of positive feedback, and working remotely it's hard, it's stressful, and it's lonely. So a lot of what we get from individuals and families encouraging us, thanking us, it's made a huge difference. And I'll tell you, the service coordinators, it means everything to them. And finally, I want to talk about, we've got the class of 2020 graduating. Unfortunately, there won't be too many parties, or at least not now, but we're taking extra steps to reach out to those individuals who are graduating from high school, to get them ready for life after high school. And service coordinators have a lot of information about what options are waiting for people, day programs, secondary education, employment. We really want to help our people get jobs and maintain jobs. So there's a lot to think about and a lot of options, and it's very daunting for a lot of people, and daunting but exciting. So we're there. We have information, guidance. We can answer questions. You can check out the website. there's information about adult services on the website. All the service coordinators have the information you need. And we are planning specific transition to adult services trainings. So people will be able to get specific information in a group. So we really do want to make this rocky time smooth for people. We love you guys, service coordinators. They are kicking butt, and they are available, and they're ready to serve you. So be well, be safe.
Hi, my name is Liz Spencer, and I'm the director of the Family Resource and Empowerment Center. Just want to touch base with everyone and let you know that we understand that there's tremendous need across our communities. People need resources, they need information, they need items. And as we are finding out about the need, we're trying to build up reserves to help in and meet those needs. We've out of desperation, been quite creative. I want to take a moment and really thank our vendors, Empower Tech, Peer Mentors, Michael's Learning Place, amongst others. Forgive me if I'm not including everybody. A special thank you to Elizabeth Hirsch Neftali, who really just supplied us thus far with nearly 3,000 washable masks that we've been able to give out to our families, to our clients, to those who work in direct care. And it's been just a godsend. We'll be getting some more in this week, and we'll let everybody know how and how to access those and when the distribution will be. We have also begun a fund here at Westside. It was an existing fund, our client help fund, and we're asking folks to make donations. We're taking cash donations as well as items to our fund, and we will house the items and distribute as we find the need. Our most desired items right now are gloves and masks, cleaning supplies, diapers, and wipes, if you can imagine. And we have been delivering these items to people directly to their homes. I want to thank our staff for just really pitching in and helping us out with this. If you go to Westside's website, you will find a button that says donate. We'll also be putting a letter on there from our interim executive director, Tom Kelly, discussing some of the need in our community and how you all can help. And we've been receiving a lot of phone calls asking how you all can help our community, and I want to just extend my gratitude to all of you for that. Another avenue I wanted to touch on was reminding folks that they can access the getcalfresh.org website. If you have gone down on your hours at work, or you're no longer working, or you've run into some real extraordinary expenses, they are including people on SSI and SSDA right now. This can be for families as well as individuals. It's a very easy website to access, and you can always call our center 310-258-4063. Any of us in our center will be happy to walk you through it. And as Hillary said, we all just want you to be well and be safe. Please call. Let us know if there's any way that we can help you, and we will do our very best to meet your needs. Thank you.
Good afternoon, everyone. Muy buenas tardes a todos. My name is Cesar Garcia, Director of Children and Early Start Services, along with Hillary there in Client Services. First of all, I'd like to echo what everyone's already has said. We understand that this is a very scary and difficult time for all of us, especially for those individuals that have a developmental disability. There are too many things that are uncertain right now as we adapt to this pandemic. But I do want to say that there's one thing that we are certain of. Everyone at Westside is doing everything that they possibly can to ensure that families and individuals are okay during this time. Self-determination, our program. This is a program that continues to be very vital and important for individuals that we support. Now more than ever, people need to have a choice and control over the services and supports that their loved ones receive. We continue to support everyone who has been selected to take part in self-determination. We have been continuing to conduct budget certification meetings via Zoom, as well as spending plan certification meetings via Zoom as well with all the families. We are collaborating with our local advisory committee in self-determination, which we've continued to meet. And we are actually going to be meeting later this month. So our next meeting is May 27th from 6 to 8 p.m. via Zoom. That information will be on our website there for people to find. In addition to that, in collaboration with our local advisory committee, we will begin to conduct orientation meetings for self-determination online via Zoom for those individuals that need to complete the orientation. So our staff will be reaching out to everyone to make sure that that is available for those individuals. Westside Regional Center Self-Advisory Committee, it has been a great partner for us. And in this whole collaboration, it's allowed us to really, continue to move this program along here at Westside. And lastly, for self-determination, I know that there's talk at the state level right now to try and obtain a waiver that will speed up background checks for essential workers in self-determination during this pandemic. So that's something that we're following and monitoring very closely in hopes that there's a quick resolution. I know there's several families out there that are ready to go. They've got everything done so that they can officially transition into self-determination, but that's the only thing that's holding them up, getting those background checks. So we'll be monitoring that closely and making sure that we provide any updates to our families. Early start transitions and education during this COVID-19 time. I want to stress to everyone that we understand that transition itself can be very difficult, and even more so during this pandemic time. Families are concerned about transitioning out of early start services in the program and onto the school district services. It's very important to us here at Westside Regional Center that we do the very best that we can in order to support our early start families during this transition process. We are working collaboratively with all of our school districts and SELPAs, and that's something that we will continue to do. The service coordinators are conducting transition meetings. They're supporting families with the IEP process, and they are also in communication with the local school districts. Our education advocacy specialists remain available to support families during this time. In addition, Liz and her team at the Family Resource and Empowerment Center are available to help families and guide them through this whole time here. In collaboration with the Department of Developmental Services, the Family Resource Center, and our education advocacy specialists, we will be putting on a 4-part webinar series for parents and guardians of children who are 2.5 to 3 years of age, who are transitioning out of the Early Start program. It's entitled Early Childhood Transition. The series begins next Tuesday, May 19th. You can find the information about the webinar on our social media as well as our website as well, or by reaching out to anyone in our Early Start department or our Family Resource Center as well. So that's something that we're looking forward to putting on to support our families. Above all, though, I want to reiterate something that's already been said. Even though we're working remotely right now, the service coordinators are all available to help you every step of the way. They've been working harder than ever right now to make sure that families feel supported and that everyone on their caseload is being taken care of in whatever way that that they need. So that's about it. Thank you, everyone.
All right, folks, we're going to be moving on to the question and answer portion of our town hall. I'd like to remind everyone that there is a question and answer box at the bottom of the screen. We're going to work through those questions first. Go ahead and type your questions in. You can remain anonymous or have your name. I will read the question in the order that it's been received, and we'll have our panelists answer it. I'm also going to be putting an email address into the chat box. If your question is not answered or you don't feel comfortable asking it in this forum, you're more than welcome to email us at traininginfo@westsidrc.org. Again, that will be in the chat box, and we can get your questions answered that way. Like I said, I'm going to start from the beginning. I have the question posed: are agencies that received SBA loans still eligible to bill Regional Center?
I will take this, but I may reflect back to Danny. If in fact, the idea, I'm hoping that they're talking about the Paycheck Protection Program. If people are taking advantage of that, a recent directive came down that we have to offset what the regional center's paying them if they're accepting the Paycheck Protection Program. So probably with this particular person, we would want to talk to them one-on-one to see what was going on. But there is some offset. And I don't know if Danny and Tom want to jump in.
That is correct. So if you're a vendor and you are receiving assistance from the federal government, then DDS has asked that you offset your billing, and they'll be putting out guidance exactly on how to do that relatively soon here. So stay tuned. But yeah, stay in touch with Mary Lou, and we'll issue guidance on it.
Next question is directed to Cesar. Do we have the slightest idea of when we will be considering going back to in-person intervention? I like to know WRC's position on that, as many of our parents are asking therapists this question, and we usually answer that when we get more guidance, we will let everyone know. Cesar knows that I am an opponent of premature opening.
I think Tom touched on this point. I think, we are definitely following local and state and federal guidelines right now. We want to make sure that everyone is safe, not just our staff, our vendors, families, everyone alike. So we are definitely going to be looking at everything that is coming down from DDS, as well as, all of our, local, state, and federal agencies as we move forward to try and develop, some kind of transitioning plan. But as we are sitting here in this Zoom meeting right now, I can't give you an estimation or an exact date of when that might happen. I think we'll just definitely monitor everything very closely and keep all the vendors, informed.
Cesar, I'm also going to add to that. I think this is going to be a reciprocal process. Like I said, I don't know if we have all the answers, but we're going to be asking for, feedback from some of the vendors and providers and trying to get ideas about how they see this progressing. So I think we're going to have to do this together, and it's going to take sort of a community involvement to really look at where we are and what does it look like. I mean, as individuals, looking at when are we going to go back to school? I'm thinking about my 4-year-old going to summer camp in Antarctica right now. But when are we going to get back to normal? And I think that's got it. But I'm definitely, our position has been to be cautious and a little bit more conservative on this. And I think that's because I really want to keep everybody safe.
Next question. Are day programs being mandated by Regional Center to call clients and provide Zoom learning?
Because we can't do community or on-site day programs, we have recommended to the day programs that to think out of the box, to be creative. Zoom is a real great tool for that. We want them to keep in touch with individuals. We are currently doing what we call absence billing. So as long as the program retains their staff and continues to reach out to people, we can continue the absence billing. But what's really important is that individuals are very lonely, very concerned, and we get great feedback from the programs that are doing the reach outs and who are doing the Zooms that people really appreciate it, and it's connecting people in a little different way, we assume, but it is connecting. So we really are encouraging day services to do so.
The next question is for Danny. I have a request to list cancellations that you referred to when you were speaking. I don't know if you'd like to have them written down. That's what the chat or the question is requesting, or if perhaps that's something we want to send out at a later date.
We can actually send out a link to the webpage on the governor's website that refers to all of the the changes to January budget. If that's helpful, we can do that. That may be more meaningful because it'll have links to details and that sort of thing.
All right, next question. Are we advised to keep our offices closed to the end of August 2020? Also, moving back into the office, what are some ways that we can help sanitize toys, materials between patients, as well as keeping our therapists safe? What cleaning supplies can we utilize without exposing clients and staff to severe toxins?
That's a lot of questions in one. I'll try to take some of the stab at it. One thing as far as providers, everybody are individual providers, so you're going to have to kind of look at how you're doing business. We're not going to mandate how things are done. But that being said, we want to be a cooperative partner. At Westside Regional Center, like how we're looking at it is probably not having, I don't know if we're ever going to get back to having a full staff on site within the foreseeable future. Until we really get this thing, we figure out a vaccine. Things that we're looking at for our offices is regular, they have like deep cleaning, they do different sanitization procedures, and we have, we have like an office staff that comes in and does cleaning, and they have different routines, and they have like sort of a hospital grade cleaning that they can do, and you do it on mutual touch surfaces. So like elevator buttons, door handles, sort of shared tables, surfaces, kitchens, anything that people are going to kind of use mutually. They can come in and they do like a really deep cleaning. And they also, we went back after the first cleaning, and it was like there was still like this residue and fog that I don't know, I might have some sort of carcinoma at this point, but I think that everybody should be following regular cleaning just like you would in your home.
Next question, is WRC receiving new applications from the intending vendors, submitted through mailing?
Vendorization continues at this point. We are cautious to move quickly through a vendorization during this time. Things are changing a great deal. Many services are going to look different than they did previously. But we will certainly begin, we are currently working with people that wish to become vendored, but it is going to be a challenging process at this point because we don't know what the new normal is and what the CDC is going to tell us and what LA County Public Health is going to tell us and what the mayor is going to say. So we're really having to be cautious as we move forward because we want to make sure that whatever's developed can go with the new normal.
Next question. To clarify, the 805 rate is not increasing, but is not decreasing either. Is this correct?
In the May revise by the governor, it is suggested that because there is such a huge deficit in the state, that one of the things that was proposed were 3 services that would get an increase. Unfortunately, they have identified those 3 services as not getting an increase, but they did not say they were going to cut those services. They just weren't going to increase them. And we don't have all the details yet, and it really, I know that Danny said this, it's really going to depend on what the federal government, how it supports California, and that can really make or break what happens with this budget.
Next question. What is going to happen with transportation?
I don't know. It's going to be very challenging. It's one of those unknowns. I know we keep talking about the new normal. We just don't know what it's going to look like several months from now. I mean, as Tom said, when a vaccine comes, everything can shift completely. But at this point, we're not providing transportation services because people aren't going to community programs. That's if and when that changes, we'll probably be reevaluating how we're able to use transportation services.
Next question. If we were intending to apply for IHSS, can we still get assistance in the process from the Family Resource Center? Or are we not able to apply due to the current situation?
You can absolutely apply for IHSS and you can receive assistance through the Family Resource Center. Ireda Galdo will be returning with some trainings that will be virtual, but in the interim, you can call us directly at 310-258-4063 and we can assist you with that.
And that phone number is listed on our website for those of you who might have missed it. Next question. Are there any service coordinators who've been diagnosed with COVID?
Yes, I believe we had two service coordinators that were identified with it.
Next question. With recent rate increases for adult day programs, are cuts proposed? How will this support minimum wage and COLA increases? That is federal requirement.
In the summary from the governor's budget today, it did say they are not touching minimum wage. That's not going to change. There were no suggestions as to where cuts would happen and what rate reductions would happen. So I think that at this point, we don't know. It wasn't really detailed. Right now, it's a very high-level summary. It has to go through the Senate and the Assembly and see what happens with federal funding. And by the time they need to pass it at the end of June, it could look the same or it could look very different. So, but they did not say what they would cut except for the mandatory holiday schedule. That seems to be on the table. And that may be the cut for day services.
Next question. Since there are a lot of budget cuts, what will happen to our current clients and future clients? Will there still be funding for these services?
Well, it's a broad question. I mean, it's an entitlement program and funding is still going to continue. Looking over the budget, like Mary Lou was saying, we don't have, it's not in concrete and we don't know. There's a lot of what ifs. Is the federal government going to reimburse California for a lot of its emergency expenditures and how much are they going to reimburse? It's going to answer a lot of those questions. I honestly was, and I don't know how others felt, but just looking at it, I was prepared for the absolute worst. It wasn't as bad as I had anticipated. It didn't look like we're going to get increases, but it looked like a lot of the services were still protected. It looked like we were going to take a hit on operations budget, but not as large as I had anticipated. So I think we're, at least for the near future and until we know more for sure, it looks like a lot of the services, like there is an emphasis to protect ongoing services. I don't know if others have any input, but I was not as it didn't hit me as bad as I thought it was going.
I just want to add that the first statement under the developmental disabilities budget was that we have preserved entitlement. And that's a really huge statement. And that is your guarantee there will be services. What they look like and how we'll be able to provide them is probably going to be different. But literally the first or second sentence was, we are preserving entitlement. So please keep that in mind.
Alrighty, next is more of a comment. It's not phrased as a question, but it does state, my son's day program has only called once and done nothing else. He's going stir crazy and he's in his 20s.
Go ahead.
No, I was just going to say that if you call the service coordinator, maybe they can either help navigate through this current day program, or we can set your son up to maybe one of the ones that's meeting more regularly. There are options, and just he doesn't have to stay with that day program now if it's not meeting his needs. So you can either get in touch with the service coordinator, or if you want to, if you want to call me and discuss it, we can do that. My number is 310-258-4281. I'd be happy to try to help you figure out a plan that'll work for your son, so he has some stimulation and some activities.
Thank you, Hillary. This next one, again, I apologize. It's not necessarily framed as a question, but it does state, I've been rescheduled twice for the dentist in WRC, so it's fine that if it has been rescheduled again until everything is 100% safe, because 50% is not enough in the future. I apologize to the person who wrote this. There is no question mark, so I'm not sure if this is a comment or if you'd like this to be addressed.
Well, I would just address it. I've been in contact. We have a dental clinic, the Lekovich is on the 4th floor, and I know that we've been working closely with them. They've been doing a lot of emergency. They haven't been there full time, but I believe they are going to be coming in more time over the summer because obviously dental care is kind of a priority and it's sort of considered essential. So they will be, my understanding is they're coming in and we'll be doing more dental care over the summer.
Next question. If potential participants are interested in virtual services, can we take a look at those referrals?
I'm going to let you know that the people that are very far along with their virtual services, I've requested for them to put together virtual tours of their programs so that we would have those available for people to explore. If someone wants to get information more quickly, they can let their service coordinator know, and we can try to link them up to the website that might show them more, or possibly the provider can reach out and show what virtual services they're providing.
Next question. What are the biggest challenges for service coordinators in being able to respond to client needs and concerns while working remotely? What are their unit managers' biggest challenges?
I can start with that, and then,
You want this one?
I think we can both answer here. I think, as I mentioned earlier, I think that service coordinators are having to really work harder because of the fact that we're working remotely, so we don't have access to everything that you would have in the office. I think we also have to remember that the stay-at-home order has really affected the entire community. That means that a lot of the service coordinators also have families at home, children that are being that are doing distance learning. They have other family members that they're supporting. All the while they're still having to do their job as a service coordinator and support families, make those calls, they're actually having to really, do a lot more coordination and balancing of what they're doing. They're doing the Zoom meetings, they're doing telephone calls, depending on the preference of each family member or each of the individuals that they're supporting. I think it's just everyone having to adapt and really, find what is working for them, so that they can support, their families. We're having to coordinate with some of the skeletal staff that is in the building, so that if, we need access to certain documents, we need letters being mailed out. It's a whole balancing act and coordination from the entire regional center, every department.
Yeah, the program managers are having to take on more of the administrative stuff in an effort to support them. There's a lot of mailings and getting records and all kinds of stuff, referrals. So, it's not ideal. No, I don't know a single person who's having a good time, but I really think they're getting the job done. They're struggling, but it's happening. Timelines were loosened a little bit, mandated timelines for writing reports or meeting with people, but I think things are moving along pretty well.
Alrighty, folks. Next question. Are there any thoughts on the possibility of keeping teletherapy even after pandemic situations have been lifted?
Mm-hmm.
There has been a discussion with the directors group and statewide that we have recognized that there is some efficacy to doing remote services, that there's a lot of things that can be done, and that there are some time-serving aspects. I mean, problem, even before this, that we have is Westside Regional Center is in a very costly area. So a lot of our staff that do a lot of the provisions having difficulty. There's a lot of, some of them, people are commuting like 2 hours a day, 2 to 4 hours a day. Whereas we're thinking if there's more time doing remote services and we can make it more effective, there's a lot more work that could potentially be done. And certainly we're not the only industry that's doing more work remotely. So this is certainly something I think we're going to have to contemplate, and we're doing a strategic planning as we do. We're looking at that as a possibility, maybe incorporating how we would do remote services, telehealth, things like that. I think that's kind of the wave of the future. I think that's where everybody's headed, not just us.
And just to add to that, today a waiver was approved so that people can bill Medi-Cal for telehealth. I don't know if there's a time limit on it, but it looks like if the state went to that level to make it a billable service under Medi-Cal, that they're looking at it as hopefully a long-term service.
Alrighty, folks, I just wanted to let everybody know we are getting towards the end of our allotted hour. I would like to remind everyone that we will be answering additional questions via our email. It is in the box, but for anybody who might have missed it, it will be on our website, traininginfo@westsidrc.org. I've been reading the questions in the order I've received them. I will go ahead and read just one or two more, and then we'll go ahead and close out for the night. Next question. Did the budget revision include any cuts to IHSS?
There is a proposed 7% cut to hours. That was the initial proposal that I saw when I read through it today.
Next question. Will there be budget cuts to speech pathologists?
I didn't see anything about speech pathologists like for early start, but there was in there about speech like through Medi-Cal and being able to bill for speech pathology for adults. I don't know. Did anybody see anything for children? I didn't see anything in there for.
Yeah, I didn't see anything specific for speech therapy for children.
Well, I'm looking at the summary right now, and it does mention podiatry, speech therapy, and others, but I think they're referring to adults. It doesn't say adults or children, so I'm going to lean towards adults, and we'll be able to get more information as we get more information on the budget.
Next question. Is there any need for feminine products such as sanitary napkins?
Yes, that's actually one of the things that was included in our wish list. So thank you for whoever posed that.
Next question. Can transition clients and those who need services for mental health still enroll in services with SP at this time while services are virtual?
In SP, what, I'm having trouble with the acronym. I'm not drawing it up right now. Is that?
It can, with SP, perhaps service provider? Service provider. Well, it was clarified.
Absolutely. I mean, people can still access mental health services. We are also going to be doing, we're working with one of our providers, Dr. Meyer Mendez, who does a lot of our groups and provides a lot, and also taking requests from other mental health providers to do online trainings, online groups. I think we recognize going ahead that there is going to be, there already is mental health impact. And so we're going to be, and we have a partnership with the Department of Mental Health, and we're going to continue with that. And we have been working with them. I know that they're still providing telehealth services. So absolutely, we're going to be focused. I mean, I think we're probably going to have more priority on that going forward.
Alrighty, and one final thing in the box, it's been upvoted a few times. Just wanted to thank everybody for your support. I don't have a question, but wanted to tip my hat to all the direct staff that have continued to provide support to all the individuals who live alone or with families during this most challenging time. They've been truly amazing. I think that's a wonderful way to go ahead and wrap up our town hall. Like I said, we will be answering any additional questions that we didn't get to via email and our website. We will have a version of this video recording posted on our website for folks who've missed it. And thank you to all the folks who have attended. And thank you to all of our panelists, this director's team, and to our interpretation services for joining us this evening. And also thank you to my counterpart, Rhiannon, for helping us get this all together from the technical side.
Only other thing I want to mention to close, and I want to also echo that, thank you for congratulating everybody, and to all the directors, thank you for being here and willing to answer questions. I hope this was helpful. I think this is something that we'll probably be doing again as we get more information, as we have more clarity on the budget, because this is a constantly evolving situation, is that we're going to continue to update the community, and if this is helpful, we'll continue to do this and to try to provide information. So thanks.